Hello and welcome to our show, Healthy Living. I'm Kayleen Cornell, Health Education Coordinator for the Purchase District Health Department. It's important that we understand the burden of stroke as a public health issue. Stroke is the third leading cause of death in the United States, behind heart disease and cancer. There are different types of strokes, but regardless of the type, surviving a stroke can have a devastating impact, not only on the survivor, but also the caregivers. Today we're going to discuss stroke, discuss the types of stroke and their causes, how to recognize the signs and symptoms, and we're going to explore a few treatments of stroke, along with identifying the risk factors for stroke and what they can do to prevent, or what we can do to prevent these risk factors. I'm joined today with Deb Welsh from Western Baptist Hospital, who's nurse practitioner there. Thank you for coming.
All right, thank
I really
you.
appreciate busy time now, but this is really important, and we have a high prevalence in our community with heart disease and stroke. And so talking today about stroke, I think, is a real important topic.
I agree, and I thank you so much for having us, or having me here to be able to talk about something that we're very passionate about.
Sure. Let's start off just
Sure.
with the definition of what a stroke is and what organ does it affect.
Okay, well, stroke affects the brain. And basically, if you think about a heart attack, a stroke is basically a heart attack of the brain. And what it does, it kills those brain cells, so it causes either the symptoms and the major disability.
Mm-hmm. Okay. So, like I had mentioned earlier, there are different types of strokes.
Mm-hmm.
Do you want to, stroke is classified by the etiology and as to what type it is?
Sure.
Yeah, could you give us a little more information on those?
Sure, absolutely. There are basically two causes, or two types of strokes. One is ischemic stroke and the other is a hemorrhagic stroke. Ischemic stroke happens when there's an artery or a vessel that's blocked in the brain and the blood can no longer get to that portion of the brain. A hemorrhagic stroke from various causes, but that's when there's bleeding into the brain itself.
Mm-hmm.
Either a vessel ruptures or something like that, which would cause bleeding into the brain.
Okay. So when we hear that someone has a stroke, what's the higher
Okay.
ratio for having one or the other?
Okay. Most strokes are the ischemic strokes. I think it's basically between 75–85% of the strokes are ischemic strokes, and the other percentage are the hemorrhagic strokes. So ischemic are the most common.
Mm-hmm.
Mm-hmm.
Okay. What would you say is the primary cause for that clot-forming stroke, the ischemic?
Well, it's going to be usually probably causes of a clot, either a clot that's formed into the vessel of the brain itself, or a clot that was in another part of the body and traveled and landed in the brain.
Okay. All right. And so what builds these clots, or do the vessels narrow, or is there something actually within the vessel that causes that clot?
Right. So if you think about a heart attack, usually what causes a heart attack is you get this fatty buildup inside the artery wall, and sometimes pieces of that plaque can kind of break loose or be a little bit unstable, and as the blood goes by, the blood starts to form a clot there, and that can cause the narrowing as well. So that can happen in the brain as well, and that fatty buildup, the atherosclerosis, is what causes that narrowing, and it just causes the blood as it going by to cause the blood cells to aggregate and to form a clot.
Okay. All right. Now for the hemorrhagic stroke,
Mm-hmm.
what would you say is that? You said there were many causes, but is there one that you tend to think that causes it?
Well, usually hemorrhagic stroke is usually caused by an aneurysm, where there's been a weakening in the vessel wall that has caused that to rupture. Then most common is probably going to be that kind of a type of event.
Okay. All right. So is this the same as we hear in other areas of the body, that you can also have these, or is this primarily specific for the brain, that where the vessel ruptures? Mm-hmm.
Well, in the hemorrhage as well, one of the causes for stroke is hypertension or high blood pressure. So that causes those vessel walls to weaken as well, and that can cause blood to leak out into the brain.
Mm-hmm. Okay. All right. When someone has a stroke, what would be is there a certain study or labs, or how can they really be for sure that it's a stroke?
Well, when
they
someone
make the
presents to the
diagnosis?
emergency room or in the emergency department with stroke symptoms, one of the first things that we do is we're trying to determine what's going on with this patient. We do a CAT scan, and really the purpose of the CAT scan is to, as we're trying to rule out what the best treatment is, the CAT scan is primarily to make sure there's no bleeding, because that can affect the type of treatment the patient receives. Usually a stroke is going to be confirmed with an MRI.
Okay. All right. Now I know Western Baptist was the first hospital in our area to become a primary stroke center. How does that, could you talk a little bit, what does that mean?
Sure, absolutely. We're very fortunate to have a primary stroke center on this side of the state. There are 20 primary stroke centers across Kentucky, and Western Baptist being the one closest I think from like Owensboro, Bowling Green area. So we're very fortunate to have this here.
Yeah.
And being a primary stroke center, what that means is that we have systems in place so that if a patient does present with stroke-like symptoms, we can activate a stroke team to urgently take care of that patient, but then also that our physicians and our nurses have had specialized training in caring for stroke, and not only just in the emergency department, but in the entire hospital. Our team consists of rehab, physical therapy. Our nurses on the stroke units have had extensive education and training regarding stroke. Our case managers and social workers are involved as well, speech therapists, our lab. Really the whole hospital is part of the stroke team, and so we're very fortunate to be able to provide this care. So patients don't have to be transferred to another area, being even farther from home. So we're very fortunate to have that here.
Sure, and I know that you've done a lot of training with the EMS team also, so your outreach with that teaching has...
Yes, and I don't want to exclude EMS or the ambulance services as being part of the stroke team, because oftentimes they are going to be the first person to see the patient, and they can call ahead of time and call a stroke alert to the emergency department. So our emergency department staff are ready when that patient arrives. So EMS is very important and a very important link in the chain of survival for stroke.
Sure, yeah. And our state just passed the bill last year with acknowledging that primary stroke centers are important.
Right, that is right. They do have acknowledged that primary stroke centers are a very important link of our healthcare system in Kentucky.
Now, when we talk about stroke as being so prevalent and that we're seeing it a lot in our community, it doesn't necessarily mean that as we age that the expectation is eventually someone will have a stroke just because of the age, but necessarily that it definitely is preventable too.
Absolutely.
I think, you know, years ago stroke was more, well, you know, when you look at the elderly, that stroke could happen, and it wasn't surprising if someone, you know, had a stroke. Right. And we tended to see people either not make it through or that they would go to the nursing home, and that has really changed.
You're right. Used to, and even my thinking when I first became a nurse many years ago, you always thought stroke was an elderly person's disease, and that's really is not the case. We've taken care of teenagers at Western Baptist Hospital, 30-year-olds, 40-year-olds that have come in and have had a stroke. So it's really a disease that knows no age limit, and really we have seen it in neonates as well that has had a stroke. And when someone that small or that young has a stroke, usually there's an underlying condition that we can identify that has caused that event.
Now, true, age does have some, the risk does go higher as we get older.
Right.
But
for every decade over the age of 55, your stroke risk doubles.
Okay.
Increases. So.
All right. And there's some other things that we really can't change. For instance, race, or what would be some others?
Okay. The risk factors that we can't change, of course, of our age. So every decade over the age of 55, your stroke for risk increases. If you've had a close family relative that has had a stroke, that increases your risk for stroke. Your race that you had mentioned earlier, African Americans experience more strokes. If you're Men experience more strokes, but more women die from strokes. Not really sure exactly why that is. But those are basically the risk factors you just cannot change as far. So if you know those risk factors, that you personally have those that you can't change, then it's important to focus on the risk factors that you can change.
Right, yeah. And having family members who have had a stroke, there's a certain age with that. It isn't the grandparent who was at late 80s
Right.
having a stroke. It is a certain age for men and women, correct?
Right.
So, so let's then look at risk factors that we can do something about.
Okay.
What
Okay.
would you say is the number one?
The number one risk factor for stroke is high blood pressure or hypertension. Knowing, first of all, it's very important to know what your numbers are, and knowing your blood pressure and keeping track of that is very important. The most normal blood pressure is like 110/70, so the closest that you can keep it at that range is the best. So it's very important to keep on track of that. If you're taking medications for high blood pressure, make sure that you are taking that regularly and that you are following up with your physician or your provider to keep your blood pressure in a healthy range.
Sure. I know I've heard people say, I don't have high blood pressure, I'm on medicine. Well,
Right.
That medicine's keeping that blood pressure down,
Right.
but you still have the
Right.
hypertension.
Right. And hypertension is a silent disease. Most people have high blood pressure. They don't even know they have high blood pressure because there's not a lot of symptoms associated with that until it gets extremely high.
Yeah, that's why they call it the silent killer.
Right. Right.
No,
And it affects not only your brain and your vessels, it makes your heart work harder, it causes stress onto your kidneys, so high blood pressure affects so much of the human system.
Really wears on your body.
Yes.
Yeah. What would you say what would you consider high blood pressure?
I would consider anything, if you want to be as close to 110/70, if it's 130 to 140, you probably need something to be watching that, maybe looking at some lifestyle modification. But if your blood pressure is 140/90, then you definitely need to be seeking treatment for that.
Mm-hmm. How close in a relationship is sodium or salt intake?
Sodium is very important as well because it causes you to regain fluid, and that increased volume can make your heart work harder and cause increased blood pressure.
Okay, because I've heard that they say just cutting back just a small amount really impacts, drops a couple points of your
Right.
blood pressure, and you
Right.
wouldn't think it would be that close of a relationship with
Right.
how it impacts it, but it really does.
Right, and really knowing the sodium content of a lot of foods. Fast foods, of course, are going to be very high. Prepackaged foods are going to be very high. So, and canned foods are very high. So anything that's processed will be very high in sodium. So, as natural and fresh that you can consume your food is the best.
Sure, and with the canned foods, just by washing them.
Right.
I think people tend to think that when they are cooking canned vegetables from can,
Right.
you have to cook them in the juice that it comes with.
Right.
Where you can drain them and cook them in
And
water,
rinse them off, right.
and you still have the flavor. Sometimes the
Right.
flavor's better.
Right.
I think how does cigarette smoking impact stroke?
Okay. Well, smoking is a modifiable or a risk factor that you can change or even eliminate to reduce your risk for stroke. So, smoking causes increased viscosity or thickening of the blood, and also can cause some irritation to the inner lining of the blood vessels. So that's eliminating smoking can drastically reduce your chance or your risk of having a stroke and heart disease as well. When someone quits smoking after a year, it's as though they have never even smoked. So not smoking is a very easily way to reduce your risk.
Mm-hmm.
And there are so many options to help people with to quit smoking. There are medications, there's then patches that are available that you can get through your provider. And also there are smoking cessation classes available in our community. So it's something, again, that can drastically reduce your risk for stroke and heart attack.
Sure, because through our health department we have the Cooper Clayton, which
Right. Western Baptist participates and
that's
Lourdes
right,
as well.
and Lourdes, and we have it in every county at the health department. So
Right. How would someone find out about those classes? Just calling the health department?
Yep.
Okay.
Yeah.
Or they could,
calling Kentucky Cancer Program,
okay,
or
Baptist
calling
Health.
the hospitals.
Right. You can call Baptist Healthline as well, and they can give you information for that class.
Matter of fact, classes are going to be starting up in January.
Okay.
So people, can be searching in their communities. How about atrial fibrillation? You hear people talk about, oh, I have an irregular heartbeat, I've had it forever, it's not a big deal.
Right.
But it is when it comes to stroke, and
it
needs to be watched.
Right. Atrial fibrillation, again, is another risk factor for stroke. Because what happens, you have the upper and lower chambers of your heart. And in atrial fibrillation, it's the top chambers. They're not quite functioning the way they should. Instead of pumping and synchronized with the lower chambers, they just kind of quiver. And what that does, it allows the blood to pool inside those chambers. And then when blood pools, of course, then you can get little clots. So with every heartbeat, you have an increased risk that a clot could dislodge and travel throughout the body. And could land in the brain that could cause a stroke. So it's very important that if you do have a history of atrial fibrillation, or you have atrial fibrillation now, that you keep the rate very well controlled with your medication, and that you take some kind of anticoagulant, such as Coumadin and some others as well.
Mm-hmm. Okay. And so that's what you were talking earlier about, having a clot form someplace else,
right,
and moving up.
Right. Or if you've had a DVT, had a blood clot in your leg, that could dislodge, or pieces of that could dislodge and travel as well.
Sure, yeah. How about diabetes? Now, I know, for people who have diabetes, if they keep it in control, that's the best way to prevent any other risk factors. Right. But stroke and diabetes is definitely, one of the risk factors for that. It is,
and that's another number that's very important to know. Not only if you're diabetic that you know what your blood sugars are, but you know what your hemoglobin A1C is. And when we check a hemoglobin A1C, what that tells the practitioner, that tells them how well you're managing your disease of diabetes over a 3-month period. Your red blood cell lives for 90 days. So by doing this simple blood test, they can see how well you're managing your blood sugars.
Mm-hmm. And
so again, that is another very important number to know if you're a diabetic.
Sure, yeah. And people who have diabetes that don't keep their diabetes in control like they should,
right,
are 2 to 4 times higher risk for having a stroke.
Right.
So it's important to know. You can live healthy by having diabetes, but if not, it just adds higher risk factors.
Right.
What would you say cholesterol? Because I always thought, honestly, the first time that I ever heard that the number one risk factor for stroke was blood pressure, because in my mind I always thought cholesterol, because
right,
that had to have been what was causing the clot, and that's what would cause a stroke. So I was surprised to hear, but as you described, there is a reason why blood pressure is the number
right,
one risk factor. But cholesterol has a big part in the risk factor.
Absolutely, and again, that's the third number that's very important that someone knows. Not only that they know what their total cholesterol is. Typically, if someone has a total cholesterol of over 200, that would be considered high. But you need to know what your good and your bad cholesterol numbers are. Now, as far as your bad cholesterol, that's the LDL, and that's really the one we focus on for stroke. We want that LDL to be less than 100. So that again, and that'll be another number that's very important that people know and keep track of. And you can lower those numbers, through diet and exercise, healthy diet, low fat, low sodium diet. But then sometimes people need a little bit of assistance with statin therapy. There's several different types of medications, but a lot of people rely on statin medications to bring that down.
Mm-hmm. Yeah, and it depends on your family history. Sometimes right, you can know a person who does everything, does the
right,
physical activity and does the diet and everything, and still the cholesterol's real high, and sometimes,
right, and that's the genetic factor that you just you can't change that.
Sure, yeah.
Because right. I'm like you, I've known people, they've done everything right. They're exercising, they're watching their diet, having a healthy diet, taking their medications as they're prescribed, and again, it's just that genetic. They got the short end of the stick.
Yeah.
On the genetic side as far as that.
Yeah. As far as stroke and disability, because stroke is, one of the main adult disabilities, reasons for having adult disability.
Right.
How has that changed over the years, do you think?
Well, I wouldn't say, I'm not really sure how much it has really changed, but stroke is the #1 cause of disability, and I think just having that awareness that there is treatment available for stroke can help decrease that disability. And then there are different treatment options as well. So I think recognizing the risk factors for stroke and knowing what the signs and symptoms of stroke are can help decrease that disability as well.
Sure, yeah.
Seeking early treatment.
Right, yeah, and you bring up what's the best way to think of the symptoms? Because there's a lot of symptoms that you think
Right.
of stroke,
Right.
How we can recognize a stroke. What's the best way to remember?
Well, I think if you've lived in this area for the last 3 years, you've really seen an acronym that's very easy to remember, and it's FAST, F-A-S-T, where F is for face. So if you or someone you know think that they might be having a stroke, you would have that person to smile or stick their tongue out, and if one side is kind of droopy, then that would be a sign. The next is A, or arms. You have them raise both of their arms, and if one arm drifts down, or maybe they can't raise that arm at all. S is speech. Just have them say a simple phrase. If the speech is slurred or odd, or maybe they can't speak at all, which a lot of times people then think the person is confused. Mm-hmm. And then T is time, and that time is really the most important. The earlier from the time the symptoms occur until they seek treatment, the more brain cells, or the less brain cells are going to die. So the longer you delay seeking treatment, the more brain cells. Every 15 minutes during a stroke, that treatment or that you delay treatment, the risk of and the severity of the disability is worse.
Sure. Yeah. What are some of the treatments?
Okay. Well, one of the very first treatments when someone presents to the emergency department with stroke-like symptoms, one of the first treatments that we begin screening for immediately is TPA, or tissue plasminogen activase. Really, it's the clot buster. And that is only given to people that meet specific criteria. So once the person begins experiencing stroke symptoms, it's very important to come in immediately, because this can only be given up to 3 hours from the last known well or normal time. So the earlier that you can get to an emergency department, the best. Once that person arrives in our emergency department, they're seen by the nurse, urgently seen by the physician, and then they're taken to CAT scan to make sure that there's not something else going on that's causing these symptoms, and to make sure there's not a bleed. Mm-hmm. Because when someone receives this clot-busting drug, one of the risk factors is bleeding. The risk with that drug is bleeding. So we want to make sure there's not something else that's causing these symptoms. Mm-hmm. Also, when someone arrives to the emergency department, there's other testing that needs to be done so that we can safely give this medication. And so, again, that can take anywhere from 30 to 45 minutes. There's a lot of things that are going to be done in order to see that this person is eligible to receive this information or this drug. What's really important about having a primary stroke center such as Western Baptist is that if you're not eligible for that drug and for some reason you do not receive that drug, stroke patients that are treated in a primary stroke center, evidence has shown and research has shown that they have a better outcome and a decrease in their disability. And I'd attribute that to the specialized nursing care and the specialized training that our nurses and our physicians have in treating stroke, and also with our rehab as well.
Sure, yeah. As you said, TPA is for just a targeted group
Right.
of certain person that has the qualifications, I guess, that you might think
Right.
of for the drug.
Right. We have an extensive checklist, and we have to make sure that the person meets all of these criteria before so we can safely give that drug.
Sure.
Because that drug does have a 4 to 6% risk of bleeding with that drug. So we want to make sure that we are giving that drug safely.
Mm-hmm.
But when you look at the chance that the drug could very well reverse or even decrease the symptoms or the disability, the risks really do outweigh the benefits outweigh the risks with that. So,
Sure,
but we
yeah.
want to make sure that we're giving that drug safely and accurately.
Sure, yeah. Also, are there any other treatments that can be used?
Absolutely. There are some treatments available. Unfortunately, they're not available here because they have to be done at a comprehensive stroke center. And those stroke centers are like Vanderbilt, University of Louisville, UK. And so what those treatments are, if it is a clot that has formed in the brain or has landed there, there are devices where they can go in and they can remove those clots. Mm-hmm. And again, that's just for the clot removal, and hopefully they can restore blood flow.
Sure, yeah. Most important is for people to understand that time is just so much of the essence.
Right.
You lose so many brain cells,
right.
Every second that
right.
it's crucial.
Right.
That
treatment that I mentioned earlier, there's several different devices that do that, but that can only those treatments are only available up to 6 to 8 hours from last known well. So again, time is very important. And you were right. With every minute during a stroke, 2 million brain cells die. So it's very important to seek early treatment.
Yeah, and I think. Like you said, our community has really learned to know what FAST is. I hear that and I see it in the community more and more each day, and that's a great thing to have everyone understand. The more you understand how to recognize stroke and to know the emergency of it, I think it comes down to semantics sometimes. I've never known anyone who didn't know what a heart attack was.
Right.
But we want everyone to know what a stroke is also.
Right.
So.
Right. And in the people caring for strokes, that is something we've overcome. Like I said, I've been a nurse really for 22 years. And so when I first started practicing, you thought, well, there's really not much we can do for stroke. This clot-busting drug came out in 1996, where it was approved by the FDA. So, there is a lot that's been done for the treatment of stroke, and people know that heart attacks are an emergency and that they need to seek treatment right away. And that's something that we want, that we're working on for stroke as well, that stroke is an emergency and that there is treatment available. That's why it's so important to get treatment very early.
Sure, yeah. Well, we're in good hands to know that a lot of the hospitals are working, towards the stroke readiness, and to definitely have a primary stroke center right in our neighborhood. It saves lives.
It does. It really does.
Thank you, Deb, for coming today and talking about stroke. Hopefully you've learned that there is good news. Stroke is preventable, and you can reduce your risk of stroke. Knowing the risk factors, and what are the things that you need to do to maybe make your lifestyle and your traits that you have a little healthier. Though we can't change some things, we can change a lot of risk factors. So thank you again for watching our show, Healthy Living, and thanks again, Deb.
All right, thank you.